Today, I wanted to talk about the importance of pelvic health. So this is the world that I live in. I treat pelvic health issues all the time. I've been a pelvic health physical therapist and have been treating pelvic health conditions for the last 10 plus years. So what are some of the issues that pelvic health issues that people are dealing with that we commonly see? And they tend to fall into three categories: pain, peeing, or pressure in the pelvic area. So I want to use some examples to kind of really showcase how important pelvic health is to your overall health, and to kind of highlight why, if you are dealing with some of these issues, you should make the choice to seek help about them. So first example, let's think about a woman who potentially has noticed that now when she exercises, she starts to leak urine when she runs or she jumps. And so in the beginning, she kind of jokes about it, maybe, and, kind of makes a big joke in exercise class, like, oh, I got to go pee before class to avoid this. And sometimes even go and pee before class, she doesn't avoid it. And so a lot of times women just start decreasing their activity level. So maybe they used to love to go to these high intensity workouts, but they slowly start decreasing. They're like, well, I can't jump anymore because that makes me leak. Well, now I can't run anymore. That makes me leak. Now I can't do this exercise anymore. That makes me leak. And so they're slowly decreasing their activity level over time. Okay. And when people greatly reduce their physical activity level because of bladder control issues, there's long-term health consequences to that. So a less active person is going to have more rapid loss of bone density. So we need healthy pounding activity to keep our bone density up. A less active person is going to have a decrease in muscle mass over time, and that's going to decrease faster than someone who's staying active. Body mass index may raise and put them at more risk for metabolic issues or other health issues, cardiovascular issues. And there's a whole host of health issues that are the result of inactivity and gaining weight. So you put yourself more at risk for that. And if you are gaining weight due to inactivity, then your mental health might suffer. You're not feeling like you're doing as well or as good as you could be. And mentally, maybe you don't have the clarity or that as you did before, and you're just kind of feeling down and blah. Okay, so that's a simple example of how what seems like, oh, I just leak a little bit when I run or jump, can really kind of come down and lead someone to a life of inactivity. And we don't want you to see you going down that path. We want to see you stay active in the ways that you want to be active for the rest of your life. Okay, so that's an example with bladder leakage. What about with, let's go to the pain side of things. What about pain with sex? Okay, this is something that we commonly see here. And so if a woman's having pain with intercourse, maybe she's even unable to have intercourse because it's so painful, then her relationship with her partner is going to suffer. Okay, and that's going to affect her mentally and physically. It's going to affect her relationship with her partner. It's going to affect her partner. If they have kids, it potentially can affect their kids because they're having to deal with the fallout of it. So this can have kind of a wider reaching effect than just the person who's suffering with the pain. And affect more than just the physical effect. It can affect mentally and emotionally as well. So that can be a very trying experience. And we see many women who, one of the main reasons why they are now seeking help, even though they've been dealing with pain for a long time, is that this has taken a toll on their relationship, and they need to do something about it because they're worried that they may not have a relationship to go back to if they don't. So we don't want people to have to get to that point. We want people seeking help earlier on because there is help out there. All right, so that was an example about pain. What about an example about pressure? Pressure is oftentimes related to when women are dealing with pelvic organ prolapse issues. And that so oftentimes, especially if the woman is in the early postpartum phase or even in the menopausal phase, these are the two times where I really see people coming in with the diagnosis of pelvic organ prolapse. They're in shock. that this has happened, and they don't even realize really what's going on. Oftentimes they had no idea this was even something that could happen. They had no idea that their internal organs could start to fall out. So many women are extremely shocked when they start feeling these symptoms and really don't know what to do about it. And we have many women who come in feeling very broken, that their body has deceived them and that they're feeling broken, and really that they don't know what to do to get their body feeling back to whole again. And so again, we see women who really start to limit their activity and avoid things that they used to love to do for fear that they're going to make things worse. They don't want to worsen the prolapse and the pressure that they're dealing with, and so they stop doing things. And unfortunately, again, as we saw with the example with the bladder leakage, that can be a downward slope to being less and less active and potentially having more and more health issues. So we want to prevent that downward slope from happening. So as you can see, resolving these pelvic health issues has a much bigger impact than the issue itself. It affects mental well-being, emotional well-being, physical well-being, social well-being, our activity level. So lots and lots of things are affected by pelvic health. Really, a woman's long-term health, mental, physical, emotional, and quality of life are at stake when we're talking about what's going on with their pelvic health. So it pains me to hear when women brush off issues like urinary leakage or pelvic pain or pelvic prolapse issues, because I know that there's stuff that you can do. So to all the women out there, issues with your pelvic health are treatable, and oftentimes very conservatively, without the use of surgery or medications, especially if you can partner with a good pelvic physical therapist. Your health and your quality of life can be greatly impacted if you get help. So my final message to everyone here is don't suffer in silence. Please reach out, talk to your friends, talk to your healthcare providers, leave us a comment, give us a call. We are happy to be a resource for you. We just want to make sure that you get the help that you need.